So CRPS sometimes called as a complex regional pain syndrome or chronic regional pain syndrome. Both way it can be called, and it is a chronic neuropathic pain. It is not an acute pain, it is a chronic neuropathic pain disorder with a significant autonomic features that is also associated with that, and typically develops in the extremity after acute tissue trauma and persists beyond the duration of normal QE. That is the entire definition of CRPS. For number one, it is a chronic neuropathic pain. Second, it is associated with autonomic features. Third, it develops usually in the extremity after a trauma. And four, it persists beyond the duration of normal healing. All these 4 points we have to give for its definition. And in addition to the classic neuropathic pain characteristics like intense burning, hyperalgesia, allodynia, etc., there may be local edema and changes suggestive of autonomic imbalance or involvement like altered sweating behavior, skin temperature changes, and trophic changes in the skin, hair, nails, etc. can be present with loss of strength. And it's also divided into two. The other name for CRPS1 is reflex sympathetic dystrophy, and the other name for CRPS2 is tarsalgia, reflecting the presence or absence of documented nerve injury. The signs and symptoms are related to all these things. This picture gives you an idea about what are all the things that are seen. Mostly it is in the extremity. So the injury or trauma is shown in the hand here or the wrist, and then the whole thing affects the whole thing. The three colors are given for peripheral and central mechanisms of the happening of CRPS, and the pink one says the typical signs and symptoms of CRPS, and the blue thing shows the mechanisms based on the treatment, how the treatment is based on the mechanism. So the changes that happen, the pathophysiology is there is a neurogenic inflammation, trauma, inflammatory response, then there is a peripheral sensitization of the nerve, sympatho-afferent coupling, then central sensitization, maladaptive neuroplasticity. So starting from the periphery, the changes gradually go up to the brain. So all these changes have, and this also results in psychological symptoms and increase in catecholamines. Then the typical signs are there is a sympathetically maintained pain, then focal osteopenia, then inflammatory signs like edema, redness, heat, pain, dysfunction, then spontaneous pain or hyperalgesia, allodynia, central motor symptoms such as severe dystonia, disturbed body scheme. All these things are the signs and symptoms. And the mechanism of based on the treatment are physiotherapy, occupational therapy, intrathecal baclofen, analgesics, combination of analgesics, short-term treatment of steroids, bisphosphonate, sympathetic blocks, behavioral cognitive therapy. So this one picture gives you all the information that is needed for that. Anyway, the etiology, it can be fracture, surgery, genetically mediated. Evaluation you can do by Budapest criteria, which is a pain disproportionate to the inciting event. Report of one symptoms, 3 out of 4 following categories like sensory, which reports as hyperalgesia or allodynia, vasomotor, temperature alteration or skin changes, pseudomotor reports of edema and skin changes, motor and trophic changes which are there seen in the skin, nails, etc. The third thing is display of at least one of the signs. So patient may complain, that is this symptom that the patient gives, the signs that you elicit also related to the above categories. And finally, there is no other diagnosis. So it becomes a diagnosis of exclusion also. Okay. So that is how the whole thing. The summary of pathophysiology is a mechanism. Altered cutaneous innervation leads to central and peripheral sensitization, leads to altered SNS function, increase in circulating alteration in the catecholamine level, lower norepinephrine versus unaffected limb, Then inflammatory factors, brain plasticity, genetic factors, and psychological factors. So all these things are the mechanisms of, and this is a picture again to show how all these mechanisms are working to produce this chronic pain condition. So that is our treatment. Pharmacotherapy, anti-inflammatory medications, including oral corticosteroids and non-inflammatory, have been tried. Bisphosphonates, which inhibit the bone marrow cell proliferation and migration of inflammation, and routinely used in bone-related problems. It is more useful after a fracture repair or fracture surgery. And anticonvulsant and antidepressants like gabapentin and amitriptyline, NMDA antagonists like ketamine, interventional therapy can do sympathetic blocks, lumbar sympathetic block for the lower extremity and stellate for upper extremity. Then spinal cord stimulations also have been tried. Dorsal root ganglion stimulation also they have tried, and so that completes the answer for that. So this much is enough for the CRPS question.